Hey, good evening, ladies. Hey, thanks for joining me for tonight's Wellness Wednesday. I've got a really big topic for you. Before I get into that, though, I'm going to wait to see who's jumping on, and we're going to say my disclaimer that I need to do. So, first of all, anything that I say during this Wellness Wednesday is only health information and is not considered health advice. Do not start taking or stop taking or change the way you are taking any of your medications. Please first consult with your prescribing practitioner to help you do so. And by attending tonight's Wellness Wednesday, this does not establish a doctor-patient relationship. So, all right. So good to have so many of you joining. I'm going to, again, I'm going to introduce this topic. It's a big topic, all right, because so many of you are dealing with this issue, and in fact, the main cause for a lot of your hypothyroid symptoms and this hypothyroid state that you are in is because of one of these types of conditions. In fact, when you have this condition, it's almost like a springboard for many other conditions of similar causes. And all right, I'll cut to the chase. We're going to talk about autoimmunity tonight, and so this is such the incidence of autoimmune disease has been rising exponentially. As I even look back over the over the last 5-7 years, we've seen that these conditions have just risen exponentially when it comes to the incidence. So, and this topic, and as far as dealing with low thyroid conditions and even hyperthyroid conditions, is huge because it is by far the main cause. And if you have attended my master class in the past, or looking forward to attending the next one, which again, we don't have dates nailed down, but we will be having another one in the fall. It's the main cause, and we have to know about this. So I wanted to talk about autoimmunity tonight to give you some understanding of what's going on with this type of with these types of conditions. Okay, so now I'm going to give you some statistics, and I know these may be a little boring, but I think it's worth going through some of this. The National Institute of Health estimates that 23.5 million people, okay, 8.5% of our population here in the US, have been diagnosed with one or more of the 29 most common and best studied autoimmune diseases. And the prevalence is considered to be rising. And there's some, some studies, sources for that statement. Well, less well-studied syndromes are also, when they're taken into account, an estimated 50 million individuals, right, in the United States alone, suffer from autoimmune-mediated diseases or disorders. That's more than people with heart disease, which is around 26 million, and cancer, which is around 18 million, put together. So autoimmune diseases are chronic illnesses with most having no available cure, right? So lifelong treatment is needed for these diseases that cause substantial morbidity, or health issues. And I'm just giving you some language here that you might see as you research this. Disability, okay? They cause significant disability, mortality, which is death, and huge costs. Get this, approximately $100 billion in annual direct health care, or I should say sick care costs, are attributed to autoimmune diseases. And most have few treatments with medications that can only palliate the immune system or treat the symptoms caused by the underlying autoimmune mechanism. These are difficult to diagnose. The signs and symptoms overlap with so many other diagnosable conditions and diseases. It takes, on average, 5 physicians and 4.6 years for an actual diagnosis to be given. Isn't that? So, and then it is really only a diagnosis with a name and a particular specific issue that they have given, some name to. And this really only to fulfill the need for, a code in your chart, which then affects your insurance and pre-existing, condition list if you have to apply for new insurance or, say, life insurance. Oh, and not to mention that 45% of individuals with an autoimmune disease reported they had been labeled a chronic complainer as they began to notice symptoms early on, all right, before their diagnosis could be determined. And remember, it took a long time, over 4.5 years on average. If you've been through this, I want you to know I'm sorry, first of all. The testing for autoimmune disease is lacking. And because symptoms overlap, it can be so confusing with the available information and outdated guidelines for these conditions. Adherence to guidelines is, low also, I would say. And for example, despite guidelines recommending, for example, routine monitoring of TSH levels for those of you with Hashimoto's or anybody with Hashimoto's, taking medication for Hashimoto's, hypothyroidism, studies show that up to 40% of those people have abnormal TSH levels. Now, those of you who have attended my masterclass know why that is, because this understanding is still very much lacking in traditional medicine, because they're not taking into account all of your thyroid markers to fully understand, fully put together the whole puzzle. Some of the leading autoimmune diseases and adults include Hashimoto's thyroiditis. So this is the most prevalent autoimmune disorder. Rheumatoid arthritis, systemic lupus, Sjogren's syndrome, celiac disease. Okay, and there are some studies showing this. There are, however, anywhere between 80 to 100 autoimmune disorders with much variation as to what body system or organ is affected, and associated health issues too. So Graves' disease, rheumatoid arthritis, Hashimoto's thyroiditis are reported with the highest prevalence rates. And then comes, celiac disease, autoimmune hepatitis, other more commonly occurring autoimmune diseases like systemic lupus, Sjogren's, multiple sclerosis, myasthenia gravis, inflammatory bowel disease, Addison's disease, and even fibromyalgia is listed as an autoimmune type condition as well. There are definitely, there is definitely a female predominance for autoimmune diseases, most tending to develop during the adult years, including during childbearing years for women. And then differences in prevalence of autoimmune diseases according to race, ethnicity. These are only beginning to emerge, and only with specific conditions. Okay, autoimmune disease most often follows a progressive course with serious or life-threatening complications developing. These, of course, lead to functional limitations, disability, poor quality of life, like we were talking earlier. And there are many other causes of death. I mean, diseases, among diseases, these autoimmune diseases rank 8th among the leading causes of death for women younger than 65 years old in the United States. And that was in 1995. From what I have seen with this exponential increase of these diseases since then, I'm sure it is higher ranking, and it is. But I've spoken about the immune system function in a previous Wellness Wednesday, but I will say again that the immune system is a complex and elegant mechanism for dealing in a balanced way with a wide range of harmful bacteria, viruses, cancer cells, to a wide range of foreign proteins and other substances known as antigens. okay, that gain access to the body, all right, while trying to maintain self-tolerance. Or, there's a modulated response, okay, that occurs. But this is, those who develop these autoimmune conditions, this balanced or modulated response is lessened or lost. And unregulated immune activity then produces ongoing inflammation and this lack of self-tolerance, okay? So this is a destructive process that leads to cell, tissue, and organ damage. Any organ can be affected. In the case of thyroiditis, autoantibodies develop and tag specific thyroid tissue. Well, other tissues can be targeted as well, like the gut and brain. In multiple sclerosis, so this normal but then misdirected effort, autoimmune effort, damages the myelin sheaths around the nerve axons in the brain and spinal cord. In rheumatoid arthritis, primarily the joints are involved and are targets for autoimmune damage, but other autoantibodies can cause problems elsewhere in the body with this condition. All right, so there is a big difference of opinion relating to the presence of autoantibodies in the blood for these types of conditions. And there is a relatively high false negative rate too when it comes to antibodies in blood samples. I have told you numerous times that that if you have any antibodies at all against thyroid tissue like TPO and thyroglobulin, this is functionally diagnostic for Hashimoto's. This is the root cause for your hypothyroidism, and it is most of the time, up to 95 to 98% of the time, or for other thyroid conditions, some other forms of hyperthyroidism. Okay, so what about risk factors? Medicine dances around the genetic risk factor for autoimmune disease, right? Really unable to identify the mechanism, saying it's complex and affects more than one trait. And they're getting close, but because there are no specific genes for any specific autoimmune condition, right? They just haven't nailed this down. And again, if you've attended my masterclass, I've showed you the testing that we do to show genetic variability with biotoxin susceptibility that most of you have, which is why these conditions tend to run in families. These genes also give us clues as to what other causes might actually, what the other causes might actually be. So we know what specifically to treat. And this is exciting, right? If we know what's going on, we know what to treat. Okay, some other risk factors include environmental factors like infectious agents, like viruses, bacteria, stress, sex hormones, heavy metal toxicity like mercury, pesticides, herbicides, cigarette smoking. Okay. Also, imbalanced gut microbiome has been linked to development of various autoimmune diseases also. And I'll go into just a little detail about each of these now. So stress influences the adrenal glands to produce cortisol and other stress hormones. This impacts downstream effects along the way. The immune system works by impacting what kinds of and number of autoimmune T cells are produced. Men and women veterans with PTSD, all right, were found to have significantly higher risk for the diagnosis of one or more autoimmune diseases than veterans with no history of trauma. So, but keep in mind, war trauma is not the only type of trauma, however, that induces PTSD. So please consider that. Studies show that sex hormones are a factor in autoimmune disease due to their metabolites' effects on immunoregulation, or how well the immune system is regulated, which can lead to auto or self-reactivity, right? Because they help lymphocytes develop. And then autoantibodies causing self-destruction, in other words, and cytokines, meaning inflammation, okay? Lymphocytes are the virus fighter white blood cells in our bodies. All right, cigarette smoke and exposure to tobacco smoke has been found to be a potential trigger for autoimmune disease, mostly rheumatic disease like RA, rheumatoid arthritis, and lupus. And I'll tell you, the mechanism is likely through the estrogenic effects of cadmium, which is most prevalent. It's the most prevalent heavy metal in cigarette smoke, whether primarily inhaled or inhaled secondhand. All right, so cadmium. Another heavy metal, mercury, is associated with inflammation and autoimmunity, causing autoimmune antibody generation just by itself, tissue damage. So inorganic mercury tends to lead to lupus, a lupus-like syndrome, right? Okay, another risk factor, farming and pesticides have been associated with systemic autoimmune diseases. Medicine continues to be unclear about these mechanisms. However, functional medicine research has found important connections. Certain organochlorine insecticides, brominated pesticides, as well, are suspected culprits because they interfere with iodine metabolism within the thyroid's hormone production machinery, right? And also they interfere with thyroid hormone conversion in the liver. All right, so now what should the approach really be? Medicine's approach to treat specific symptoms and palliate the immune system with immunomodulatory drugs or immunosuppressant drugs, right? This is their go-to. These are also recommended to be long-term, meaning lifelong. And they all seem to have unwanted and adverse side effects, and some of them have quite a few. They say that long-term management requires a multidisciplinary approach, right? So referrals to specialists, nutritionists, physical and occupational therapists, and even counselors. And this effort should be coordinated by the primary care doctor with clear articulation of specific roles, right? Management should also include stress reduction interventions. Well, this is all well and good, but when I practiced primary care and I would attempt to coordinate such efforts, and my patients would return from the specialist that I'd referred them to, wondering why in the world I sent them there. Okay. You know, if you've been diagnosed with these conditions, ask yourselves, has your primary care doctor gone through this effort to really coordinate this care? Have they done the proper evaluation, which includes kind of a mental health psychological evaluation too, because of, what I said earlier about the importance of stress and PTSD. Again, if you attended my masterclass, I gave you a roadmap for how to overcome these conditions and any, thyroid condition really. So treating symptoms with drugs and suppressing the immune system does not lead to reversing any of this or putting these conditions into remission with any consistent results, if at all. Okay. And as for my discussion of the roadmap and how to actually follow it, it takes a week to present to you in a masterclass format. I will finish up tonight with a brief synopsis of what I do to help my patients use that roadmap. All right. So instead of treating symptoms autoimmunity is driven by triggers. And these triggers are biochemical events that occur in our body relating to the risk factors that I've just identified that essentially throw gasoline onto the autoimmune fire. That fire burns and destroys, affecting tissues and organs. So in order to stop this fire, to put it out, we must identify your unique triggers and imbalances by first getting thorough, comprehensive testing. During my master classes, I am able to offer that comprehensive testing that I do to those who attend and who would like me to go through it with them to give them a comprehensive diagnosis and a customized care plan. In general, that customized care plan includes individualized coaching, helping our patients make the right dietary changes, which are best customized to the individual. Customized exercise interventions, if exercise is indeed warranted at first. Customized supplement protocols targeting the specific triggers one has based on thorough comprehensive testing. Now, there is growing evidence, scientific evidence, that regular programmed physical activity is beneficial for autoimmune disease. Physical activity leads to an elevation in T regulatory cells, decreased immunoglobulin secretion, so decreased antibody production, and a decreased production of autoreactive T cells. Physical activity is also shown to promote release of what's called an IL-6 from muscles, and IL-6 derived from muscle has been shown to induce an anti-inflammatory response through the IL-10 secretion and something called IL-1 beta inhibition. Now, sorry for all the nerdy stuff, but that's what this helps with. Now, the beneficial role of physical activity is well documented for patients with rheumatoid arthritis, systemic lupus, and type 1 diabetes. Okay. And observed outcomes include milder disease course, decreased fatigue, and certainly increased or improved joint mobility. Well, that makes sense. Some enhanced quality of life and improved cardiovascular disease risks. Okay, on the flip side, with others, unfortunately, too much exercise may exacerbate Hashimoto's thyroiditis and insulin resistance, leading to type 2 diabetes. It really must be customized. This is the bottom line. It must be customized to the individual. And some have to cut back on the intensity and duration of their exercise programs, especially if you have Hashimoto's and certain other autoimmune diseases. All right. So this goes contrary to current medical guidelines. You must understand, though, this is an individualized approach. The answer isn't always eat less and exercise more when it comes to weight gain associated with autoimmune diseases as well, which is typically what happens with Hashimoto's and resulting hypothyroid state or the hypothyroid disease that you get because of that. I discussed this in great detail in the masterclass. All right, then retesting is needed as one goes through the process, which allows for recustomizing of care. And this leads to the best outcomes. We see a typical response with patients doing very, very well. And the other thing is I've always found it necessary to gain understanding from a patient's perspective when it comes to his or her illness or disease, to ensure that their primary concerns are actually being addressed. The model of care that I've just gone over, including truly finding out what specific triggers are causing the autoimmune disease, which is, again, putting you at risk for developing multiple others if you know you have one, and I've found this to be the most successful way, over my 11 years of practicing functional medicine. And it always has to center on finding the right information about your specific disease process. All right. Now, I have not gone into specifics about any particular autoimmune disease, really. I mean, just a few here, but the approach to treatment is the same. We have to find your triggers and put the fire out, right? So I won't be answering questions live tonight. I have, have to keep a tight schedule tonight. As I've gone over a lot of information here, I need to wrap it up. So for tonight, if you do have any questions, please put them in the comment section, and I will get to them as soon as I can. All right, ladies, thank you for attending tonight. Take care, and remember, have hope. There are answers, and you still have the ability to heal. All right, good night.